Today on Let's Wrap, we continue our conversation with Danelle Humphries. Last episode, she told us the many personal ways her life has been touched by hemophilia, from her father to herself, biological children, and adopted children. Now, as part of We Are HPC, she takes us on a journey of the impact of her work as an infusion care nurse. Infusion nurses are such a big part of HPC, just so important to the process. And I know home visits were happening even before COVID, but now more than ever, how important is that ability for you as a nurse, to go to someone's home, help them, make them, feel safe and give them that care without them having to expose themselves maybe to going to a facility?
I think having us being able to go see patients in the home has been a huge kind of weight lifted off of some of their shoulders. Some people I know were going into infusion centers, into places and facilities to get treatment. When COVID happened, some of that even like went on hold as some patient facilities, closed down treatments and or kind of limited appointments and things like that to try to distance patients. Where now we're able to go into the home and see them. So for one, it helps, kind of keep their schedule on track and keep up with their treatments. And it's just a lot easier than them trying to have that fear of, okay, I'm supposed to distance myself. I'm supposed to stay out of the public, but I'm sick and now I have to go into where there's a lot of people. And so being able to stay at home and have us come see them, they're not getting out, they're not having to go through all those steps to even get into a facility, get their temperature taken and, wait in line and wear the mask and, stand around and, not be able to have family members present for visits and things like that too, where we're able to go into the home and so they can have their family there. And, we're still wearing masks, we're still being safe, but there's just kind of that comfort level because they're in their own space where, they are more comfortable.
And when you go into the homes, dealing with both adults, sometimes children, but I'm guessing you get to know the families quite well. How much of a difference does that make when someone is about to get a treatment, but they know you and you're someone that's familiar to them?
I think there's just that again, it's that comfort. Like it's you start to build a relationship, you start to build trust. When you go into the facility, you never sometimes know who you're going to get. It's okay. Well, are they going to be able to start my IV? Are they going to be able to access my port? Or do they know about my medication? Is it a lot of patients we see have more rare diseases, so the medications and things like that they take aren't super common and we again are in the home, every visit, it's the same person. It's kind of that continuity of care. I know where your good veins are. I know where, I need to maybe have you positioned so we can access your port easily. I know where your supplies are, things like that. I know about your medication. I know who your doctor is without having to kind of play that 20 questions at the beginning of every visit. We just get to kind of come in and get started and so I just think there gets to be a lot more trust that they're getting the same care every time. They're dealing with a nurse that knows them and knows their history and knows what they've been through. Some patients, when they've had an illness for a long time, you don't want to have to tell the whole story from start to finish of when did this happen? How did you find out you had? It's not always something they want to rehash over and over and.
Right.
It could be part of that medical intake. You need to have that knowledge, but it's not something they have to necessarily trudge up every time they have a visit. It's just, like, how was your trip? How was, how are the kids doing? Or, that thing that led me to work for HPC. It was early on when my son was only about a year old. I was at a conference and actually met people from HPC and kind of their care model. Helped me meet other parents that also had kids with hemophilia and just kind of gain that confidence that um, even though we had this diagnosis, life was going to be okay and my kids were still going to be able to be happy and healthy and be regular little kids and I could still be a mom and you know and and not have to have so much stress and so much worry and HPC just kind of gave me those tools to be able um, to do more at home. I was a nurse and, I could take care of anybody else's kids, but when it comes to your own, it can be really hard.
Mhm.
No, mom, I don't want a shot, those kind of things. It's like,
Right.
okay, well, I can tell you have to do it anyway, but this isn't a home visit that I'm leaving. I'm here now. So I have to, kind of just make it through those harder times. And, so I went kind of from being that really scared mom with a little baby with hemophilia, um, to knowingly traveling across the world to adopt two more because it's something we can manage. It's something we can do, and raise these kiddos to just be normal, happy, healthy kiddos, even if they do have a bleeding disorder. It, can be really manageable. And so much of that is too, because we can do things at home. We're not having to, live our life in a facility and go to a hospital all the time. And, I've got pharmacists I can call and ask questions to if you have a question about a medicine, and backup nurses, if you have a question, you can call them. And, it just makes the day to day so much easier.
When you go into your home visits and see patients, do most of them know your story, and what kind of reactions do they get?
Um, Not always at first. I tend to be a talker, so a lot of times it comes out eventually anyway. Sometimes I do try to share with new moms, with hemophilia or anything, a little of my story, just to let them know, I've been there too. Like I get how hard this is. Not just because I'm a nurse and I've seen other patients go through this, and so I know it's hard, and I know it's hard as a parent. Um, I've been the mom on the other side. Sorry, I'll get choked up again. Um, Being the one to have to hold your kids still to let somebody else maybe do a lab draw or start an IV on them, and it's scary, and they don't like it. They don't understand it sometimes when they're really little, um, and so it can be really hard. And um, so just to try to kind of share with them that, when I say these things, it's not kind of just a canned reaction, or, kind of my little spiel to tell you as a nurse that, they'll get better and they get more used to it. And, when our son was little, our biological son, and we had to do infusions, um, I would have to have extra family come over to help hold him still. He was a
Oh,
wiggly little thing and did not like it. And I mean, there might be four of us trying to hold him still on my living room floor, to give him an infusion, which I think just sounds awful to a lot of people to kind of imagine that. Um, but he didn't understand, and he was scared, and he didn't want to do it. And, we were interrupting whatever he was in the middle of, whether he was hurt or not. Stopping to let us do his treatment was, not in his plan, and he didn't want to do it. And then within a year, going to him just sitting at the table and holding his little arm out and letting me do it all by myself, and so that it does get better. It's hard because it's kind of unknown. But it doesn't have to be hard forever. That, sometimes it's just a bit of a process for everybody, for the patient to kind of get through, and the parents kind of get through. But, there is the other side of it, and we'll get there. Um, but I definitely understand it, on all levels. How hard it is as a nurse to just, try to do your job and, take care of patients the best you can. But, how hard it is as a family member on the other side to see your loved one, kind of going through those rough things, because it's not fun for sure.
What's your best advice from everything you've learned as a nurse, as a parent, to those dealing with hemophilia or even another kind of chronic health issue?
Probably the biggest thing is just to be your biggest advocate, and to gain as much knowledge as you can about your condition, whatever it might be. Um, there's a lot of more rare diseases, and, doctors and nurses, they see things like diabetes and high blood pressure over and over and over again in a day. But then you have folks like us that come along that it's like, you have what? And it is maybe isn't something they've seen a lot, and it maybe isn't something that, they haven't heard of a lot. And it doesn't make them a bad medical professional at all. It's just something they're not as familiar with. But the more knowledge you can have yourself, and be willing to share that with those that are taking care of you and around you, just overall how much better things will be. You know yourself, you know your body, you know your kids, you know that, and you kind of a lot of times have that gut instinct. And so to always, be willing to kind of speak your part and, be part of that care team. Just because you have nurses doing this and doctors doing this and maybe another specialist doctor doing something else, the patient themselves are really active part of that whole team. And so you need to have a voice and you need to say, how you're feeling or what your opinions are, because it's not that things are being done to you. It should be things are being done for you and with you. And so that you need to just be a part of that team, and be active in your own healthcare, whatever it might be.
Is there anything else you'd like to add that I haven't asked?
I feel really fortunate to work with HPC and just all that they offer. Um, Again, I've seen it from both sides, not only as a nurse being allowed to do my job and feel like at the end of the day, I've really done the most for my patients and taking care of them, with all the tools that I need, to, get them what they need and, provide them the best care possible. But just from the family side of it and, having been a patient parent myself and, just seeing what we have to offer and, how nice it is to have, just a whole team that, if something comes up, you're going to be able to call them and have them help you. So you're not going through things alone. It's just, it's really been a blessing to, come across such a great place to work and such a great group of people that again aren't just my coworkers, but they're kind of my backup if I need some help. So it's been great.
Danelle Humphries, HPC specialty infusion nurse. You have an amazing and inspirational story to share. Thank you so much for joining us on Let's Wrap.
Thanks for having me.
You've been listening to HPC's Let's Wrap, a podcast by HPC Specialty Infusion for patients and providers. We're proud to specialize in patient health and happiness at hpcspecialtypharmacy.com or call 1-800-757-9192.